you explain us in few words what cybertherapy is?
Yes, cybertherapy encompasses a large and growing field of using technology, advanced technologies for healthcare, such as therapy, rehabilitation, physical rehabilitation, cognitive rehabilitation, anxiety disorder treatment, diagnosis and assessment and treatment of schizophrenia, eating disorders, obesity, and various other areas. What we're seeing more and more of is the technologies becoming less expensive and more portable. So often we have teletherapy, telerehabilitation, things that we can have the patient do at their home, sometimes do across the internet, and this allows them to become more active participants and for the continuum of care to continue from the clinic into the patient's home setting. I've organized the conference for the past 13 years, and the 14th conference will be co-organized by Dr. Giuseppe Riva of Istituto Oxologico and myself. I'm very pleased to say that we will be doing the 14th annual International Cybertherapy Conference in Verbania, Italy in June 2009. I expect that because the Italian researchers in virtual reality are one of the strongest groups in Europe, and because over 50% of our colleagues come from Europe to the conference each year, I think that this will be a unique experience for people that have not been able to come to the U.S. for the conference in the past, to attend, to see the state of the art in the field right now, to learn from that, and hopefully new collaborations and cooperations will come as a result of the conference. I think some things are more advanced in the U.S., such as commercializing the products. I think some things are more advanced in Europe, such as doing the really hard controlled trials. And so to marry the two, to come here and learn from my European colleagues more closely. Also, I've started a journal. It's called the Journal of Cybertherapy and Rehabilitation. That is based in Brussels, and I wanted input from the European community on that. I also started an association in Brussels called Cybertherapy and Rehabilitation. And what we're trying to do is speak with a collective voice, one voice, so we can inform and educate the general public, the scientific community, the European Commission, ministries of health, education, and other policymakers and funding agencies so that they can understand how advanced technologies can help healthcare. And so I am very pleased to continue to strengthen my relationships with Italy and with my Italian partners. My first involvement in cybertherapy was in 1994. I attended a conference called Medicine Meets Virtual Reality, and I heard someone speaking, actually from Italy, speaking about using virtual reality and physiology to treat anxiety disorders, specifically phobias.
Did you invent the word cybertherapy?
Good question. I'm not sure if I invented the word. I think it was probably jointly invented by several of us that were partly the pioneers and founders of the field. And that more or less reflects what we have always done. We've always worked as a collective group. We're a very close-knit group or family. There aren't a lot of us in the world doing cybertherapy yet. So I think probably to say that I invented the word would be incorrect. It was probably a group of us drinking a glass of red wine. I'm very pleased and excited and very honored that I will start to be a professor at the Catholic University in Milan starting next year. Actually, I got my official letter in 2008 and will teach my first class in 2009. I will teach first a course on how to write a scientific paper in English, and more specifically how to write a scientific paper.